Good morning, Illini. We are back with another Healthy Illini podcast. I'm your host, Matt Schrock, and I'm excited to share this time with you. I want to remind you that these podcasts are just the start of conversations. They're not the end all. They're not where we wanted to be done at the end of this. So we'd love for you to engage with us, give us feedback, bring your questions. Also, stick around at the end. We'll give you some more resources and let you know ways you can continue the conversation, ways you can connect with us. But today we're talking about Mckinley Health Center and all it has to offer. Hopefully we will answer some of your questions and expand your knowledge on what's available, what you can take advantage of, ways you can get your questions answered. And so let's get right into it. Today I'm joined by a couple special guests, some students and one of our professionals here at Mckinley. And first up is our special guest, whose name you'll probably recognize if you were on campus or were a student during the 2020-2021 school year. Joining us is the director of Mckinley Health Center, Dr. Robert Parker. You may also know him as the Spit Doctor, as we affectionately refer to him around here because he signed off on all those saliva tests last year. Dr. Parker has been practicing medicine for 40 plus years, and he's been the director here at Mckinley since 2017. So Dr. Parker, thank you so much for joining us.
Yeah, it's great to be with you, and it's going to be exciting to have all the students back this year. So I'm really excited.
We also have a couple campus wellness ambassadors here with us, Casey Gonzon and Sean Williams. Casey, thanks for being here. Tell us a little bit about yourself, your major, how long you've been with Wellness Ambassadors.
Hi, thank you for having me. I'm a community health major. I've been with the Wellness Ambassadors for now 2 years, and I'm an upcoming junior this year.
Hi, thank you also for having me. I am going to be a rising junior this year, and I am studying food science and human nutrition. I've been a wellness ambassador since last fall of 2020, and I'm excited to do it again this semester. So,
I'm really excited to have you both here, partly because you're part of this initial kickoff for this Healthy Illini podcast. You're stepping into something completely unknown to you guys. There's no precedent here, but you've also shown yourselves to be that type of student because you've been with Wellness Ambassadors, which was something that wasn't even a figment of anyone's imagination last March of 2020. Nobody even thought this would ever be something on campus. And so I'm really excited to have you here and get your thoughts on some things and get your questions as we look at what Mckinley does. That's really what the focus of this podcast is. We want to highlight Mckinley Health Center. A lot of people know the name or they've heard the name, but they don't necessarily know what we do. And one of the things we talk about at Mckinley a lot is bang for your buck, that we try and provide as much as possible for the investment that the students make through their tuition. So Dr. Parker, just looking at what Mckinley does, what are some things that you would want to highlight or just want students to be aware of that they might not know about as far as what Mckinley has to offer?
McKinley really wants to be your medical partner while you're a student here. Our tagline is to be well in order to excel. And obviously illness plays a big role in why student success might be compromised. And so we're, for your student health fee, we can't be everything to everybody, but we want to be something to everyone. And in that regard, we have, when you have acute medical problems, we're probably the first place you ought to start. A lot of times you can just talk to our nurses and get advice that you wouldn't otherwise be able to get. And of course, you can also come in and be seen or have a telehealth visit. We have a laboratory, and we offer a lot of different lab tests at no charge to you, over and above your health service fee. And so if you do go to see another doctor and they need to get some lab tests, sometimes you can just get them done here and it won't cost you anything. Similarly, if you need a plain x-ray, now we don't have a CT scanner or an MRI scanner, but if you need an x-ray, a chest x-ray or an x-ray for a sprained ankle or something of that nature, we have all of that here. And so in mental health services, we do a fair amount of counseling, not to the same level as the counseling center on campus, but we do have counselors here. And we have psychiatrists that can help you with your medication management while you are a student here. So we don't do anything to try to replace your home doctor. We just simply want to supplement things while you're here on the campus in order to help you navigate your academic success as a student.
You brought up, you mentioned, kind of as we went through the health service fee, and I know that's a question that a lot of students have. I was talking, Casey was talking about this, about some of the things that she's come across. So Casey, if you want to touch base on that, what are you said you've gotten some questions about the health service fee. What has come your way as a wellness ambassador?
I often hear complaints of people, actually, some students who are wondering, if we could waive the student health insurance, why can't we waive the health service fee?
Yeah, that's a great question. Our health service fee, this includes services at McKinley and at the counseling center, is $244, I believe, per semester currently. It covers basically all of the counseling that you get at the counseling center, plus the services that you get here at McKinley. It also covers an awful lot of outreach on campus. And I would probably start with the outreach because obviously students don't have to pay anything to come to an outreach event. And that's because all the students have already paid. It would be very difficult to charge some students who haven't paid and other students who have paid, for example. Also, if we see probably 60 to 65% of the entire campus at least once during the year. The other thing is we find a lot of times the students don't really care one way or the other whether the fee is waived. It's more often the parent. And the beauty of McKinley is the student can come to McKinley and discuss matters and get testing, let's say sexual health related issues. They may not want their parents to know about that, which they would not be able to control under a traditional insurance arrangement, but they can have that freedom in confidentiality when they come to McKinley. So we think it's actually to the students' overall advantage not to have the fee waived, but obviously that is a common question, and it's certainly something that we talk about with the Student Advisory Board on a regular basis, but it's always been a fee that the campus has mandated from everyone.
I do want to plug the Student Advisory Board just for a moment, but mention that part of the reason we wanted the wellness ambassadors here is that this podcast is meant to be a conversation. And it's meant to be a conversation between McKinley and students. So we wanted the student voice. But Student Advisory Board is another place that happens. That a lot of things that McKinley does and the way we offer it and the way we approach it is through a lot of interaction with the Student Advisory Board, with student committees. And so that's something that we really try and get that voice. And that's why we're here. That's why we brought in Sean and Casey as well. And I know that one of the questions that Sean was bringing to me, and I'm going to have him just kind of ask a few things on this, is we're moving into an unprecedented time with coming back from the COVID shutdown, from the restrictions, and going into a very uncertain fall. So, Sean, you had a couple things you were wanting to ask, and I'm going to turn it over to you just to give you a chance to do that.
Yeah, so I kind of wanted to know just from the history of what we've already experienced with COVID at the university from fall 2020 semester and so on to spring the 2021 semester. How has McKinley tried to accommodate the students during the pandemic, and what was the level of difficulty in executing some of the new procedures and protocols through the health center?
Yeah, that's a great question. We were really fortunate to have already started a movement towards telehealth. And the Student Advisory Board wanted to create that as an option for students even before the pandemic. And so we had started that journey, and so when the pandemic hit, it was really just a flip of the switch for us to move from face-to-face care to telehealth care. And so we really never shut down at all. We immediately started with telehealth, and we went from just a few visits a week to practically every visit was a telehealth visit there for many months. And then as the pandemic began to subside a little bit and vaccines were available and students, gosh, we gave about 17,000 vaccines to students once the vaccines became available. And so as things got better, then we went back to face-to-face care. So we really were fully operational pretty much through the whole pandemic, and it's was one of the few areas on campus that was able to be fully operational.
Speaking of that, Dr. Parker, so for this upcoming fall, will McKinley take in-person walk-ins, or will the McKinley continue having appointments held virtually?
Yeah, so that's a good question. As some of you know, when McKinley is fully operational, we have the ability to walk in during our operating hours, and we had, because of social distancing and capacity limits and all of the things that were associated with the pandemic, we had to basically go to an appointment-only arrangement. We're going to start the fall off with an appointment-only arrangement. The Student Advisory Board would like to get us back to a walk-in model, as soon as we can. I'm particularly now with the Delta variant and all the things that we're futzing with as we try to go into the fall. I'm not sure that it's realistic to think that we'll get back to walk-in in the fall, but hopefully by spring semester we'll be able to do that. And it really just all depends on where we are in the whole COVID thing.
Sean, you also mentioned a really good point that I would like to kind of ask, but you had mentioned about mental health and the stress of everything with the pandemic. You kind of touched on it, but if you would go ahead and just kind of share what you were asking on that.
Yeah, obviously enough. We have been through a lot of mentally and physically draining period of just this entire pandemic, and I think that a lot of students want to have some sort of security when they come back onto campus, and I think everyone would feel a lot better if we knew what we could do as far as steps to ensure that our mental health is seen as a priority coming into the fall.
Well, it's a huge issue. If you look at just this past year, about 40% of all of our visits, whether they were telehealth visits or face-to-face visits, had a primary mental health component. That compares to probably half of that prior to the pandemic. And so this issue of the effect of COVID and the pandemic on our sense of mental well-being has been huge. Students have obviously had family members with COVID that have been very sick or worse, and friends that have gone through a lot, and obviously the shelter in place is not very healthy. We've all been through a whole lot in this regard. Just know that there are a couple of things as we go into the fall, and that is understanding work-life balance is going to be real important. So the work that our health education outreach educators do is going to be real important in helping students maintain their mental health so that they can just get through the semester amidst all the academic stress. So learning, getting enough sleep at night, moderating how much alcohol you drink, how much pot you smoke, all of those things are going to be important towards trying to have a good sense of mental well-being. And so the education component is huge. Now, for those students that are trying to do all those things and still struggling, we have our primary care providers, we have our counselors, we have our psychiatrists, whose schedules fill up very, very quickly. And the goal here is not to take one student and see them every day, but it's to try to provide some tools to as many students as possible, so that as many students as possible can continue with their academic success. So you can't rely on McKinley to be a your full solution. If you really are having a lot of mental health needs, you're going to have to establish with counselors in the community or from home and find other ways to meet all of those needs. But for the student that needs a little bit to help them move forward, McKinley is a great place to start.
There's the old adage, and you've probably heard it. It says it takes a village to raise a child, and we often attribute that to children, but it takes a village to help anybody, and that's not untrue here on campus. And so I like what you said, Dr. Parker, about McKinley can't service everything for everybody, and it takes a community. And part of that is, I'm going to segue here a little bit. Part of that is also with the wellness ambassadors, that you guys are involved in this,
Absolutely.
and you have a very growing importance role as we go forward. So I want to shift just a little bit and ask you, share a little bit what you offer to students, or what how you can be utilized to help your fellow students, to help the student body. What can they expect if they contact you, or how they should contact you? Just a few minutes just to kind of touch base on what you do and what you can offer, especially this fall as we get back into in-person instruction.
Well, I see ourselves as the liaison between the university and the students. We break it down in simpler terms that we as students would be able to understand and digest and to act upon efficiently. And so a best way to contact us would be through our social media platforms, which we use to promote different things from the university that they are implementing to keep us safe and to keep our students within a great and sustaining environment.
Yeah, and usually when people think of wellness ambassadors, they think of the people on the quad passing out masks and hand sanitizers. But I feel like we got really important roles last year too, in terms of keeping morale up and advertising other things we could do on campus that is COVID friendly but also fun. So for example, we worked a lot with the Illini Union last year, advertising events like Build-A-Bear or free painting on the quad, just to keep the spirit up during the semester.
Yeah.
And that goes back to the conversation about the mental health side of it. Just feeling something, a connection to something, or feeling supported, or just having a chance to do something like Build-A-Bear that is not, worrying about a vaccine or worrying about quarantine or worrying about class schedule. It's something just to let you breathe for a minute. That's really important. We will get to at the end of this podcast, I'll list off some of the resources you can have, but you can also go to our bio on this episode, and you will be able to see the social medias for the Wellness Ambassadors, also McKinley links. So if you have more questions or you want to connect, those will be listed in the biography of this episode. We're about out of our time, but before we get out, I do want to talk about some of the things that we're looking to in the future with McKinley, because healthcare changes so quickly anyway, and on a campus with a student body that constantly is evolving, and you're bringing in a new crop of students every 4 years at least. And so there's always transitions there, and as Dr. Parker has said, we were already working on telehealth. It just happened to, fortuitously, we were working on it when we need to pull the trigger. But there's some other things happening on campus that McKinley is looking towards, is doing right now. And so, Dr. Parker, you want to just highlight a few things that we're trying to implement to be more serviceable to our student body?
Well, sure. Students are more and more wanting to, you Google for information. Students want self-help. And so we've tried to, one of the things the Student Advisory Board very much wanted to experiment with was basically vending certain products so that students didn't even have to come to McKinley. And so we put a vending machine up over in Eikenberry Commons. We're experimenting with that. We're trying, preliminary evidence is that students will often talk to a nurse on the phone, then go to the vending machine, or just go to the vending machine and get products to treat their cold for a couple of days, or other aches and pains, and see if that works for them. And they may not even need a visit to McKinley. And so we've played in that space. I think that as we evolve our telehealth, we're going to find that we're going to be able to do telehealth a lot more efficiently than where we were during the pandemic. And so we're trying to move that whole initiative forward so that lots of things can be done very quickly in terms of putting orders in the system for labs and that sort of thing without you having to physically come in here. And so that's all basically part of this journey towards you being able to make choices and help yourselves in a way that allows you to continue your normal student life and not have to tie your day up trying to come into McKinley for something.
Do want to highlight with that, there is a McKinley Wellness app. If you go to wherever you get your apps, you can find that, and it really with that self-help and that idea that you can quickly take care of, or get information or find out more. If you go to that app, it's got links, it's got games you can play, it's got health tips. It's just really a wealth, and it's evolving too. As we evolve at McKinley with what we serve, we're updating the app with ways you can be interact with it. So really want to encourage you to check that out as well. And we're just going to kind of throw this out here, Sean and Casey. Is there any questions you have as far as where McKinley's headed, or anywhere you would like to see McKinley go in the future? Options there. I'm putting you on the spot here a little bit because I didn't prep you on this one. But is there anything that comes to mind like, hey, this would be really cool if blank blank?
Well, I did think it was really interesting that you talked about the vending machine in Mckinley. I actually haven't heard of that before. And I do agree that sometimes it is a bit of a hassle getting here into the actual building, especially if you have like a cold and you sent your friend out to get you medicine. I do think that it would be nice to see more of those vending machines around campus. That would be really cool.
Well, we're gonna give it a run for. We want to see what a regular semester looks like financially and from a popularity standpoint. We want to see what that looks like, and then perhaps in the spring we'll take all the data to the student advisory board, see where they want to go with that. And then we are looking at putting additional vending machines up potentially in the summer or fall of next year based upon what that data shows. So stay tuned.
We do have a planned podcast coming to talk about a COVID booster along with the flu vaccine. And so some of that information will come out in that as well. We can address some there. But again, that's great. If you had a question that came, if you have a question you're listening, send us your question. You can do it through the links that we'll list. You can go to our Anchor site or wherever you get your podcast. A lot of them have the link where you can send us a voicemail, and we'll talk about that at the end as ways you can contact us. But we do want to hear from you. We want to get feedback from you. Sean and Casey, you guys have a unique position as wellness ambassadors, that you get feedback from students directly, because we know this. There are times students will talk to other students, they'll never talk to a professional and whatever. So you hear a lot that we don't necessarily hear, but you also have a unique perspective on some things. So how do you hear about what McKinley does? How do you hear about the various services or things that are offered? And do you have suggestions on how McKinley could better reach some areas that aren't being reached right now, or students that aren't hearing about what we have to offer?
Well, I think there's a few ways that we automatically see McKinley's presence on campus, just through advertisements, so like the buses and when the dorms. I feel like we see McKinley-esque decor pretty prevalent throughout the university. But then we also have the people who work in these systems, in these dorms and facilities, that offer advice to saying you should go to McKinley for this, or you should call the telehealth center for this. And they're very informed and equipped to be able to guide students into McKinley's direction if needed. So
yeah, I really do like how you described McKinley as decor on campus, because I feel like that's really true. And because it is decor, it's sometimes like we're blinded to it, if that makes sense. We see it so often, you kind of forget that you can contact McKinley because you see their number on the bus. So I think maybe in terms of trying to get more of a student response, something a little more engaging, more interactive in terms of
definitely
advertising,
social media.
Promotion.
Yeah.
A bit more.
One of the things that we're going to play with, I'm guessing, when all the students come back, is a chat bot that's going to be a part of our website. And we already get a lot of students that write in on the comment page on the website, and that gets looked at every day, and we get back to the student as long as they give us their name. Sometimes it's anonymous, but a lot of times the students do give us a way to get back to them. But we also think that the chat bot is going to be another way of trying to get students informed, where they can just, obviously we have to teach the chatbot what to say, and so we're working on that now, and I can't tell you exactly when this is going to be out, but it's coming along real well.
Well, that about fills up our time for this, for you guys. So I really appreciate you being here, Sean, Casey, Dr. Parker. I just really appreciate you taking your time out to speak with us today.
Thank you for having us.
Thank you for having us.
Thank you. Go Illini.
As you can tell, there's a lot happening at McKinley, and there's more to come. We're here to serve the students of UIC, and we continually seek to increase our ability to do so, to find new ways to try and do that. I want to thank Dr. Robert Parker, Casey, and Sean again for joining me today. And as always, the conversation doesn't end here. I hope something piqued your interest, and if you have questions or comments or just want to know more, here are some resources to do so. You can go to our website at mckinley.illinois.edu. You can also check us out on Instagram at McKinley Health Center, no spaces. You can go to our anchor.fm page and you can leave feedback via a voice message. We can't follow up with that voice message. We don't get contact info. We just simply get the recording. So if you want us to email you or contact you, you need to leave that in the voice message. But all these links can also be found in the episode description. Thank you for joining us today. You are on a personal journey no matter where you are in it. You are important. You matter. Your health and wellness are important and matter, and we are here to keep you well to excel. So go have a great week. Connect with us. Let us know how you're doing, and we will catch you next week on Healthy Illini.